COVID-19 took weeks to spread around the world.
We knew it was coming, and it was kind of like that slow motion car wreck that you watch on a YouTube video or something like that.
Dr. Anuj Mehta saw it up close. Slow at first, then faster than anyone imagined.
And then we finally got hit in March of 2020. And all of a sudden, it was like a switch on the light. It turned from one patient, two patients, to 40, 50, 60, 70 patients. And then eventually our hospital was really full with patients with COVID-19.
The pulmonary and critical care physician at Denver Health says as the hospital filled up, the third floor was converted into a new ICU. Supply and space suddenly tight.
Yeah, there were definitely times where we were down to our last 10% of ventilators, or when we were down to our last 1 or 2 ICU beds. The other dimension I think that was really hard was that COVID, especially early on, tended to affect entire families at once. It was super infectious. It spread really rapidly, and you'd see 5 or 6 members from an entire family in the hospital. And there were times where we'd have grandma and grandpa in the ICU, mom and dad on a regular floor, so not on a ventilator, but still really sick, and the kids at home being taken care of by relatives.
But who wasn't allowed in the hospital proved hardest.
When we couldn't have visitors, family members were really worried that their loved ones would die alone. And at Denver Health, we have a saying, nobody dies alone. And I remember holding people's hands as they took their last breaths because their family couldn't be there, but I was able to tell that family, your loved one didn't die alone.
Taking calls from other hospitals, from Texas to Alaska, asking if they had an ICU bed. Denver Health cared for everyone they could. Dr. Mehta says the state's plans and policies kept people safe too.
Yeah, I think that definitely some of our vaccine mandates, our masking mandates, decreased the spread, blunted the peaks, and definitely saved lives.
The full impact of COVID-19's deadly spread is being studied now, 5 years later. But as funding for public health is continually cut and pushed aside, Mehta says it makes it harder to prepare for a future pandemic. So hospitals like Denver Health, he says, are staying sharp in case of another global event they hope never hits.
That's the hope.
Dr. Mehta says the politics of states, from mask and vaccine mandates to who reopened businesses and when, did impact the numbers of people getting seriously sick. Measures that also led people to lose business, their jobs, even health insurance. Mehta says the pandemic is something that is still being studied, analyzed, and looked at, and will be for years to come. Rachel Krause, 9 News.